In this section of Part 2, we will talk about public health in proper. Public health is about preventing disease from occurring or prevent it from getting worse once it occurred, and to promote for a better health with the objective to live longer, healthy, as well as good quality of life. Public health is concerned with the health of the whole population and not just an individual. The efforts in achieving these are society's responsibility, guided and facilitated by an organized health system. In other words, everyone is responsible to oneself and to one another in achieving and maintain health. Public health incorporates the interdisciplinary approaches of epidemiology, biostatistics, and health services. Environmental health, community health, behavioral health, health economics, public policy, insurance, medicine, and occupational safety, as well as other important subfields. The focus of public health intervention is to improve health and quality of life through prevention and treatment of disease and other physical and mental health conditions. This is done through surveillance of cases and health indicators, and through promotion of healthy behaviors. Examples of common public health measures include promotion of hand washing, breastfeeding, delivery of vaccinations, distribution of condoms to control for the spread of sexually transmitted diseases, and the efforts in achieving these are the society's responsibility, guided and facilitated by an organized health system. In other words, everyone is responsible to oneself and to one another in achieving and maintain health. The overall objective of both public health, which encompasses the clinical medicine, is better health for individual and for the society. Clinical medicine is needed when health could not be maintained or when we have illness, and thus need treatment to prevent complications or to avoid death. Both of them are vital and interdependent to improve individual and public health. Ready access to high-quality health care is a right of the population. A country with good public health is a country that meets these rights. This requires the availability of high-quality providers of clinical as well as preventive care. The purpose of public health are to prevent epidemics and spread of disease, to protect against environmental hazards, to prevent injuries, promote and encourage healthy behaviors, response to disasters, and assist communities in recovery, and also assure the quality and accessibility of services. Public health has many roles. First, statutory role. This is to provide services that keep us from getting sick and treatment as the consequences of our own actions or illnesses of others. Second is population-based role. This is to prevent illness in the individuals by taking action at the community level. The third role is surveillance, for continually monitors for patterns of diseases. Social justice role is the next. This is to advocate equity for all and reaches out to vulnerable population. There are many and various functions of public health, but the core functions are assessment, whereby there is monitoring, study trends, analyzing causes, and identifying needs. Second is policy development, about the broad community involvement to promote scientific basis of decision-making, strategic approaches, development of comprehensive public health policies. And the third is assurance. This is where seeing to the implementation of legislative mandates as well as fulfilling statutory responsibilities to encourage, to require and provide services, guarantee high-priority personal and community-wide health service, including subsidization for those who are unable to afford healthcare services. And last but not least is the system management. This is actually on evidence-based practice of public health. The essential public health services include to monitor health status, which is related to core function 1, diagnosis and investigate health problems, also with regards to core function 1, inform and educate, mobilizes communities to address health problems, develop the policies and plans. The essential services 3, 4, and 5 are actually under the core function number 2. Next is essential service number 6, This is to enforce laws and regulation. Number 7 is link people to needed health services, followed by assure a competent health service workforce and evaluate health services. And these are related to core function 3. Essential service number 10 is on conduct of research for new innovations, and this is in line with core function 4. Essential services answers many questions pertaining to public health. Essential service number 1 emphasizes on the accurate, periodic assessments of the community's health, including identification of health risks, determinants of health, and determination of health needs. Attention to the vital statistics and health status indicators of groups that are at higher risk than the total population, identification of community assets that support the local public health system in promoting health and improving quality of life. It is concerned with the use of appropriate methods and technologies such as geographic information system to interpret and communicate data to diverse audiences. Collaborating among all the components, including private providers and health benefit plans, to establish and use population health registries such as disease or immunization registries. For diagnosis, there should be a timely identification and investigation of health threats, ensuring the availability of diagnostic services, including laboratory capacities, and initiate response plans to address major health threats in the community. The main activities involved are epidemiologic investigations of disease outbreaks, patterns of infections, chronic diseases, injuries, environmental hazards, and other public health threats and emergencies. Active infectious disease epidemiology program, access to public health laboratory capable of conducting rapid screening and high-volume testing. Essential service number 3 is concerned with the development and delivery of health information, health education, health promotion activities designed to reduce health risks and promote improved health. Development of health communication plans and activities such as media advocacy and social marketing. Ensuring the accessibility to health information and educational resources. And in coming up with the health education and health promotion program, it is important to ensure partnerships with schools, faith-based communities, work sites, personal care providers, and others to implement and to reinforce health promotion programs and messages. Pertaining to essential services number 4, there are various questions that it answers. First is on identifying potential stakeholders who contribute to or benefit from public health and increasing their awareness of the value of public health. Building coalitions, partnerships, and strategic alliances to draw upon the full range of potential human and material resources to improve community health, as well as convening and facilitating partnerships and strategic alliances among groups and associations. In undertaking defined health improvement projects, including preventive, screening, rehabilitation, and support programs. With regards to essential service number 5, it answers the question pertaining to the policies, and in order to develop policies and plans, we need effective local public health governance. Development of policy, codes, regulations, and legislation to protect the health of the public and to guide the practice of public health. What about essential service number 6? It actually mentions that there should be assurance of due process and recognitions of individual civil rights in all procedures, enforcement of laws and regulations, and public health emergency actions taken under the Board of Health or other governing body's authority. We also need to review, evaluate, and revise laws and regulations designed to protect health and safety, reflect current scientific knowledge, and utilize the best practice for achieving compliance. For essential service number 7, it is to ensure the identification of populations with barriers to personal health services, assuring identification of personal health service needs of populations with limited access to coordinated system of clinical care, and assuring the linkage of people to appropriate personal health services through coordination of provider services and development of interventions that address barriers to care, such as culturally and linguistically appropriate staff and materials made available, and transportation services provided. With regards to essential service number 8, it is actually to assess the public health and personal health workforce. This is to maintain the public health workforce according to the standards through efficient processes for licensing, credentialing requirements, and use of public health competencies. Continuing education and lifelong learning should be emphasized, especially on leadership development and cultural competence. Essential service number 9 is basically on the assurance of ongoing evaluation and critical review of health programs' effectiveness based on analysis of health status and service utilization data. Assurance of the provisions of information necessary for allocating resources and reshaping programs. Evaluation must be ongoing and should examine personal health services, population-based services, and public health system. The importance on quality improvements and performance management should be elaborated. With regards to essential service number 10, research is crucial to identify and monitoring of innovative solutions and cutting-edge research to advance public health, to develop linkages between public health practice and academic or research settings, and as well as epidemiological studies, health policy analysis, and public health systems research in providing evidence-based practice and evidence-based medicine. There are various activities of public health with regards to research. First, it's not only to initiate research, but also to participate in research done by others, to report the results and implement policy based on these results. This diagram shows the relationships between the core functions of public health and essential services. Adequate and well-placed infrastructures are crucial to perform the essential services. Infrastructures includes the organization, the workforce, information system, other than the physical infrastructures.